Malaria epidemiology. The epidemiology of malaria involves several interactive factors which facilitate transmission. The important factors include the mosquito vector, which is normally the Anopheles, the Plasmodium parasite, the human host, and the environment. Now let's look at the vector. Concerning the vector, species efficiency is important. Where you have got efficient malaria vectors, then normally transmission will be efficient. And this is very much affected by longevity. The period that the mosquito is able to survive. It has to be able to survive beyond the sporogony period, which is normally 2 weeks. And then vector abundance in terms of densities. We normally have mosquito densities related to the transmission cycle. So where you have got higher densities of mosquitoes, then of course transmission is normally high. Behavioral patterns of the vector species in terms of feeding and resting. Normally the most efficient vectors are those ones which are astropophilic, that they have a tendency to feed on human, and also the ones which have a tendency to rest indoors or close to human habitations. The Plasmodium parasite species distribution is important. As we know, there are 4 important malaria vector species, and all of these vary in terms of species distribution, with Plasmodium vivax and falciparum common all over the world. But of course we have got other species like Malaria and Ovale, which have localized distribution. The virulence then and the tendency to relapse, like we have in vivax, or the tendency to develop resistance as is now becoming apparent in Plasmodium falciparum, all these contribute to maintain transmission. The human host vector becomes important, and this is translated in terms of protection. The ability of the human to protect themselves against mosquito bites. So in areas where then mosquito nets are used or scaled out, the ability then of the population to afford the nets and the tendency to use the nets becomes important. So net usage as well as availability of the nets becomes important in protecting against mosquito bites, and therefore in preventing the transmission of malaria. Another factor linked to the human behavior is the ability and tendency to be able to afford and access prompt treatment. The age structure is important in that in high transmission areas, children are the ones who normally have high parasite densities, and we are talking of children between 6 to 59 months. Endemicity level, therefore, that is for large geographic areas, can be defined traditionally in terms of spleen and parasite rate in young children. And we have 4 classifications, but we normally refer to the first 2 as the low endemic, the hypoendemic and mesoendemic are the low endemic areas, and these are those areas with parasite rates of less than 50%. The high transmission areas, that is the hyperendemic and whole endemic, these are the areas which have got a high parasite densities over 75%. Malaria can be defined also as stable or unstable. Stable malaria is where you have got parasite is normally endemic, and this is common in areas with high vector populations. The unstable or epidemic prone areas are where we have got seasonal transmission, and in such areas all groups are affected, and due to low immunity in the population. The environment becomes important, particularly in terms of rainfall, and actually transmission cycle is normally very much linked with the rainfall season pattern, because rainfall then offers adequate breeding areas for mosquitoes. Irrigation activities, particularly during the transplantation and weeding, also contribute to the transmission. So then the transmission cycles are also linked to such irrigation activities. Temperature, the optimal temperature for the breeding of mosquitoes, and to some extent for the development of parasite in the human body, is between 20 and 30 degrees centigrade, with upper limits 16 and of 33 degrees centigrade and lower limit of 16 degrees centigrade. When it comes to altitude, this is very much linked to temperature, because at high altitude there's normally low temperatures. So in a lot of geographical areas, we don't have malaria transmission at altitude above 2,000 meters above sea level. Relative humidity linked also to the rainfall and irrigation activities. In areas of high rainfall, these are normal areas of higher relative humidity, conditions which are conducive for the survival of a lot of efficient mosquito vectors. Housing conditions become important. The type of house, screened houses, houses located far away from the breeding sites, these are likely to attract mosquitoes, and therefore in such areas transmission is likely to be low. Transmission intensity in general then varies across geographical areas, with varying levels of effective bite per year. And with the current global decline in transmission and clinical burden of malaria, heterogeneity in infection is becoming more pronounced. And now the focus now is to target hotspots when it comes to intervention. Spatial heterogeneous transmission is affected by variation in climate and ecological factors, as we have seen, and this affects the distribution and density of the vector population.